Hello everyone. The topic of this video is thyroid gland, and a long question is often asked on this topic. The question can be in this form: describe thyroid gland under the following headings: location and gross features, relations, blood supply. Blood supply I will not cover in this video. I'll make a separate video for blood supply and I'll put the link of that video in the description box. And then the applied anatomy. You can also be asked to enumerate the structures related to medial surface of thyroid gland. Clinical anatomy questions will be in this form. Write anatomical basis of thyroid swellings move up and down during deglutition. So what is the anatomical basis for this? Second is why thyroid gland should be removed along with its true capsule. You should always begin your answer with introduction. In this picture we can see the location, the shape of the thyroid gland. So thyroid, it is the largest endocrine gland and it weighs approximately 25 grams. It's slightly larger in size in case of females. Then it secretes T3, triiodothyronin and tetraiodothyronin, that is T4 hormones, and they are responsible for controlling the metabolic rate. It also secretes another hormone which is known as calcitonin. It lowers the blood calcium levels in our body. Now let us look at the location and extent of thyroid gland. So we can see here, this is the thyroid gland. Where is it located? It is located in the lower part of the neck. And we can see here, this will be the lower part of the neck and in front and on sides of the trachea mainly. It extends anteriorly. You can see here, this is the thyroid cartilage, this is cricoid cartilage, this is trachea. So here we have an oblique line on the lateral aspect of the thyroid cartilage. So it extends above till the oblique line. This is the oblique line. In fact, you can see this oblique line of the thyroid cartilage, and below it will extend till 4th or 5th tracheal cartilaginous ring. Vertebral levels, it lies opposite to C5 to T1 vertebra. So if you have done upper limb, then you remember the root value of the brachial plexus C5 to T1. That's how I used to remember. So the level of the thyroid gland is also, the vertebral level is also similar. That is, it extends from C5 vertebra till the T1 vertebra. Let us see the gross features of thyroid gland. So here we can see this is the thyroid gland. And here this is the thyroid cartilage, this is cricoid cartilage, and we can see the cartilaginous rings of the trachea. So above the cricoid cartilage, this is larynx, and from the lower border of the cricoid cartilage down here, this would be the trachea. So let us see the parts of thyroid gland. There will be two lobes. So two lateral lobes are there. One is this one, the other one is this one, and they are connected to each other via this midline structure which is known as isthmus. So these are the parts. Now let us see what is the size of each lobe. So each lobe approximately is 5 cm long, 3 cm wide and 2 to 3 cm thick. As I've already told you that each lobe is going to extend superiorly here till the oblique line of the thyroid cartilage, and below it will extend till the 4th or 5th tracheal cartilaginous ring. What about the isthmus? The isthmus lies in front of 2nd to 4th tracheal ring. So this is the isthmus. This will lie in front of 2nd, 3rd and 4th tracheal cartilaginous rings. Now there sometimes you'll find that at the superior border of the isthmus, a small lobe extends upwards. This is known as pyramidal lobe. So this will extend upwards from the upper border of the isthmus. And sometimes you'll find that there is a fibromuscular structure which would connect the apex of this pyramidal lobe with the hyoid bone. This fibromuscular band is known as levator glandulae thyroidae. And this is a remnant of thyroglossal duct. Thyroglossal duct, actually thyroid is going to develop in the floor of the developing mouth, right? So from there a duct grows downwards, right? And when it reaches the adult position, the thyroid gland lobes, they will develop, and this regresses. The thyroglossal duct, that regresses and disappears completely. But sometimes a remnant may remain there. right? And it may attach it to the hyoid bone, then it is called as levator glandulae thyroideae. Now, capsules of thyroid gland. Each gland, in fact, is covered by capsule. But here we have two capsules. So one is the true capsule. So this is the parenchyma of the thyroid gland. And we can see here the green inner one, right? This is the true capsule. And the outer one, the brown one, is the false capsule. So the true capsule, how is it formed? It is formed by condensation of fibrous stroma of the gland. So gland has got various lobules which are separated by fibrous tissue, the connective tissue which will carry blood vessels and nerves. And when it condenses at the surface of the thyroid gland, at its periphery, it forms a capsule known as true capsule. And the false capsule is derived from the pretracheal layer of deep cervical fascia. If you remember your deep cervical fascia, it has got investing layer, prevertebral layer in front of the vertebra, and pretracheal layer. Remember, thyroid gland is located anterior or in front of the trachea, right? So this will be enclosed by splitting off the pretracheal layer of deep cervical fascia, which forms its false capsule. Now let us look at another structure. You find there is a venous plexus which is present deep to the true capsule. So in case of thyroid, the venous plexus lies deep to the true capsule. This you have to remember, because you'll find that when you do pelvic viscera, the prostate gland also has got two capsule, and there the venous plexus lies between the true and the false capsule. This is the difference. So in case of thyroid gland, venous plexus lies deep to the true capsule. This you have to remember. Now, applied anatomy, which is relevant to the false capsule here, and or in fact to the true capsule and the presence of venous plexus, is that during thyroidectomy, thyroid gland is removed along with its true capsule, right? So thyroid gland and its true capsule all together will be removed, leaving behind the false capsule. Now, why it is done? We have already seen that the venous plexus lies deep to that, and therefore when you remove the thyroid gland along with the true capsule, the chances of hemorrhage are not there. So to avoid hemorrhage during thyroidectomy, the thyroid gland is removed together with the true capsule. If you just remove the parenchyma, then it can lead to hemorrhage from the venous plexus. Whereas in case of prostate gland, what will happen? There the true capsule will be also left behind, because the venous plexus will be between the two capsules. So only the parenchyma of the prostate gland, that will be enucleated or removed, leaving behind the two capsules in the body itself. Another clinical significance related to the false capsule and pretracheal fascia is that it has been observed that thyroid swelling, they move up and down during deglutition or swallowing. If any swelling is felt in the neck, right, so the doctor asks patient to swallow, and if the swelling is moving up and down, then the doctor is sure that it is because of enlargement of thyroid gland. So here if we look at this diagram, we can see this is a sagittal section. We can see this is thyroid gland enclosed in its fibrous capsule, that is the false capsule here. And we can see here the hyoid bone, thyroid cartilage, cricoid cartilage, and the first cartilaginous ring of the trachea. Now if we trace this pretracheal fascia upwards, right? So here it has split to enclose the thyroid gland, and it is present as a single layer, but when we trace it upwards, it is attached to thyroid cartilage and to the body of hyoid bone. Second thing is that the false capsule, which is present on the medial surface of the thyroid gland, it thickens here and forms a ligament known as suspensory ligament of Berry, which attaches this false capsule to the cricoid cartilage. Now, because of these attachments here, what happens is when a person swallows, the pharynx moves, then the larynx also is going to move, then the skeleton of the larynx, which is formed by cartilages, so the hyoid bone, the thyroid cartilage, cricoid cartilage, they are also going to move up and down during swallowing. And because the fibrous capsule enclosing the thyroid gland is also attached to these structures, so this is also going to move up and down during deglutition, or what we call as swallowing. So this helps in distinguishing the thyroid swellings from other swellings in the neck, because other swellings are not going to move up and down during deglutition. Let us now look at the gross features of each lobe. This is the anterior view. You can see here these are the two lateral lobes, And this is the posterior view. We can see the posterior aspect of each lobe of thyroid gland. Now, each lobe of the thyroid gland has got an apex which is directed upwards, reaches here the oblique line of the thyroid cartilage, and has a slightly broader lower part which is known as base, which will be till the fourth or fifth tracheal cartilaginous ring. They are also known as upper pole and lower pole respectively. Now we have some borders. Two borders are there of each lobe. One is the sharp anterior border. Here I have not marked, very short anterior border would be there. This is the anterior border which you can see, and this is the posterior border, the red line which shows here. So here the posterior border will be present and it is more rounded in nature. Now we have three surfaces of the lobe. The three surfaces are, this is the lateral or the superficial surface, right? So this will be present more anterolaterally, in fact, right? So, and border is anterior, so that's why everything present here will be the lateral to it, okay? So this is the lateral surface, or this is the most superficial surface, so you also call it superficial surface. Then second would be the medial surface, which is obvious here. You can see clearly here, this is the medial surface coming in contact with the trachea and larynx, and obviously behind the trachea will be esophagus. So this medial surface will be coming in relation to trachea and esophagus. This is medial surface. And the third surface, right, which is here, which is separated from the medial surface by the presence of posterior border, that is the posterolateral surface. So this surface would be posterolateral surface. Three surfaces are lateral or superficial surface, medial surface, and posterolateral surface, right? Now isthmus. Look, let us look at the borders and surfaces of isthmus. This is the isthmus. It has got two borders. Green lines can be seen. This will be the superior border. This will be the inferior border. And the two surfaces would be the surface which is facing front. This will be the anterior surface. And the surface which will come in relation to second, third, fourth tracheal rings, right? Coming in contact with the trachea. That would be the posterior surface. So two surfaces, two borders. Let us look at the relations of the different surfaces of thyroid gland. First, we will consider the lateral surface or the superficial surface. Part of the superficial or lateral surface can be seen here, but most of it is hidden by these muscles. So you can see here how many muscles are there? 4. 1, 2, 3 and 4. So 4 muscles will be present which will be coming in relation to the lateral surface. Which are these muscles? These muscles are, you can see here, huge muscle sternocleidomastoid, its anterior part, right? So some of the books mention anterior border because it will come in relation to the lateral surface of the thyroid gland. Then we have 3 more muscles here. These are strap muscles or infrahyoid muscles, and these are, this one going from the manubrium sterni till the hyoid is the sternohyoid, and more deep to that till the oblique line of thyroid cartilage from the manubrium sterni, this is sternothyroid. See, sternohyoid, sternothyroid. And the third one is the superior belly of omohyoid, which will be more laterally placed, right? So these are the 4 muscles. Just remember, lateral surface is going to come in relation to the muscles. You can put your hand on your neck and deep to the skin, you'll be able to feel sternocleidomastoid and the strap muscles. Lateral surface relations will be how many muscles? 4. Sternocleidomastoid, sternothyroid, sternohyoid, and this will be omohyoid superior belly. Sorry, I think this is sternohyoid, the more superficial one, and the deeper one is the sternothyroid. Now relations of medial surface. I have already shown you the medial surface comes in relation to the trachea and to the esophagus. This is the outline of the thyroid gland. So its medial surface is going to come in relation to certain structures. How many types of structures? Again, remember 4. So 4 types of structure, but each in twos. So let us see here. The first will be 2 tubular structures, that is trachea, esophagus, and obviously it will also come in relation to the larynx above and the pharynx, right? So trachea above is continuous with larynx and esophagus above is continuous with the pharynx. So 2 tubes, just remember first 2 tubes. And second will be 2 cartilages.
So these two laryngeal cartilages, thyroid and cricoid. These are the two cartilages you can have here, right? So that way it is easy to remember. Cartilages of big cartilages of larynx, that is thyroid and cricoid. Now two muscles. One muscle of the pharynx, one muscle of the larynx. This is the inferior constrictor of the pharynx, right? You have to remember, because below that it is going to become continuous with the esophagus. So it has to be the lowermost constrictor. So that is inferior constrictor muscle of pharynx. And there will be another muscle which is lying outside larynx, one muscle which lies outside, that is cricothyroid, because you can remember it this way also, because it is related to two cartilages, cricoid and thyroid. So the muscle will be cricothyroid muscle, right? So two tubes, two cartilages, two muscles. Two nerves are also there. So you have to remember these will be the laryngeal nerves. And both the laryngeal nerves, they are branches of vagus. So here we have superior laryngeal branch of vagus dividing into internal and external laryngeal. So external laryngeal nerve you can see is coming in relation to the medial surface of the thyroid gland, and this nerve supplies the cricothyroid muscle. The only muscle of the larynx supplied by external laryngeal is the cricothyroid. The other nerve which you can see here coming back here between the trachea and esophagus ascending up to reach larynx is the recurrent laryngeal nerve. This is also a branch of vagus, and this nerve supplies all the muscles of the larynx except cricothyroid. So now you'll remember, when it comes to medial surface, again four kinds of structures but in twos. Two tubes, two cartilages, two muscles and two nerves. Now relations of posterolateral surface. We have done of lateral and medial, it is simple. This is the simplest one, because posterolateral it is going to come in relation to carotid sheath. So now you know three structures of the carotid sheath, they will come in relation. And what are these? Common carotid artery, internal jugular vein and the vagus nerve. So you can see here the outline of the thyroid gland. So these three structures which are present in the carotid sheath, they will be coming in relation. And one structure which is embedded along the anterior wall of the carotid sheath, which is the structure Ansa cervicalis. Again what? Four. Three structures enclosed in carotid sheath and one embedded in the carotid sheath, that is Ansa cervicalis, right? So I hope you will remember this way, that lateral surface related to four muscles, right? The medial surface related to four kinds of structures, two tubes, two cartilage, two muscle and two nerves. And the posterolateral, just remember, carotid sheath, right? So three structures of carotid sheath and Ansa cervicalis. Relations of the borders of lobes of thyroid gland. So here we can see this is the anterior border and this is the posterior border. Anterior border, that is going to come in relation to anterior branch of superior thyroid artery. This is the superior thyroid artery. This is a branch of external carotid artery and is dividing into a posterior branch and an anterior branch. Anterior branch is going to run along the anterior border. The posterior border, which you can see here, that is coming in relation to these parathyroid glands, and there is an anastomosis between the branches of superior thyroid artery and inferior thyroid artery. So that will be coming in relation to the posterior border. Relations of isthmus of the thyroid gland. So this is the isthmus, this is the superior border, this is inferior border, this is anterior surface. Let us see the relations of superior border. So we can see here two arteries anastomosing here, and these are the anterior branches of left and right superior thyroid artery. So this is superior thyroid artery, this is its anterior branch here, and similarly here. So they will anastomose along the superior border of the isthmus. Now inferior border, if you see here, we have the beginning of inferior thyroid veins. So you can see here this is isthmus, and the inferior thyroid veins, they are going to begin at the inferior border of the isthmus, and then they form a plexus here in front of the trachea. Anterior surface, you cannot see the structures related here, but it is obvious. Remember, the lateral surface was covered by two muscles going in front here, sternohyoid and sternothyroid. So these two muscles will come in relation to the anterior surface of the isthmus also, sternohyoid and sternothyroid. And a vein also comes here from submental triangle, that is anterior jugular vein. And then obviously fascia and skin would be there. Then posterior surface, we have already seen that it will come in relation to second, third and fourth tracheal cartilaginous rings. So these are the relations of isthmus. To show the relations of the three surfaces of lobes of thyroid gland, you can draw the simple cross-sectional diagram. This is the cross-section passing through the neck at the level of isthmus of thyroid gland. So here you can see these will be the two lateral lobes of the thyroid gland, and this is the isthmus. We can see here this is the parathyroid gland, right? And the thyroid gland is enclosed in which facial sheath? This is the pretracheal layer. Behind you can see this will be the prevertebral layer, right? So here the vertebra would have been there, the cervical vertebra, and here the most superficial layer of the cervical fascia, that is investing layer of deep cervical fascia, that can be seen, which is enclosing sternocleidomastoid muscle, right? So here in the midline, if we look at the structure, isthmus is there, then we have the trachea and then the esophagus, and here we have carotid sheath, and here we have the strap muscles and the sternocleidomastoid muscle. Now with this information, let us see here the relations of the three surfaces of thyroid gland. So this will be the lateral surface of the lobe, this will be the posterolateral surface of the lobe, and this will be the medial surface of the lateral lobe, right? Remember, the parathyroid glands are present at the posterior border, so posterior border will be somewhere here. Now let us look at the relations of the lateral surface. Remember, four muscles. So most superficial is sternocleidomastoid. Then we have sternohyoid, right, which is more medially placed, and the superior belly of omohyoid, which is more laterally placed. And then the deepest one is the sternothyroid. This is sternothyroid, right? So these are the four muscles which will come in relation to lateral surface. Let us look at the posterolateral surface. Remember, carotid sheath with the three structures. This is common carotid artery, internal jugular vein, and in between the two, more posteriorly, is the vagus. And which structure is embedded in the anterior wall of the carotid sheath? That is ansa cervicalis. Again, four structures you can see. Let us look at the structures related to the medial surface, right? Here you cannot see all the structures because it is taken at the level of the isthmus, right? So we cannot see the structures which are more superiorly related. So let us see here two structures. You can see trachea, you can see esophagus, you can see the recurrent laryngeal nerve, right? So some of these structures can be seen, but remember, in total there are 8 structures which come in relation. Two tubes which you can be seen, 2 cartilages would have been there if we are taken from upper level, and then 2 muscles and 2 nerves, right? So these are the relations of the different surfaces of thyroid gland. Coming to applied aspect, now here in this picture you can see the normal thyroid gland lobes, and this is the enlarged lobe, right, which occurs in case of goiter. So here, when the thyroid gland lobe it enlarges, it is mostly going to grow posteriorly where the false capsule is thin, or downwards, right? It will not be growing upwards because it will be limited by the muscles which will be attached to the oblique line of the thyroid cartilage. It won't be able to grow there. Medially also, the capsule is very thick, so it won't be able to grow. So either it grows posteriorly or goes downwards, right? Now what happens in patients with such enlarged thyroid gland, right, in case of large goiters, they will have certain symptoms, right? So these are dyspnea, that is difficulty in breathing, because this enlarged lobe will press on trachea. So dyspnea, difficulty in breathing. Dysphagia, difficulty in swallowing, because again this lobe is going to press upon the esophagus, so that will lead to dysphagia. Dysphonia, that is hoarseness of voice, would be there because this enlarged lobe would put pressure on recurrent laryngeal nerve. Remember the recurrent laryngeal nerve between the trachea and the esophagus? That will be compressed, and recurrent laryngeal nerve supplies all the muscles of the larynx except one, right? That is cricothyroid. So all other muscles are supplied by the recurrent laryngeal nerve. So when it is affected, this will lead to hoarseness of the voice. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.